Hello everyone. Hope at this time of this COVID-19 pandemic, everyone is still well and staying safe. I'm Dr. T here, a consultant physician currently practicing in Oriental Medical Center in Malacca. I'm glad that today I'm given the opportunity to speak on this Facebook Live event. And the topic today is diabetes. What's the big deal? Yes, I'm sure that most of us have heard of this condition called diabetes. However, based on my observation and my experience after speaking with many patients and my friends, family members, I feel that most people do not take the condition of diabetes seriously. Due to the commonness of this diabetes, many people have taken it very lightly. You have diabetes? Oh, no big deal. My uncle has it, my father has it, my friends has it. You see? So with this talk today, I hope that I will be able to raise the awareness of the public toward this disease of diabetes. So what is diabetes? Diabetes is a condition whereby the sugar level in the blood is persistently high above the abnormal range. In Malay, we call it kencing manis, or in Mandarin, we call it tang niao ping, or in the Hokkien dialect, we call it ti jo, which literally means sweet urine. When the blood sugar level is too high in our body, the excessive urine will be passed out through the urine. Thus comes the term kencing manis. This is a diagram showing the organ pancreas. This is our pancreas. We have one pancreas which is located in our abdomen. So pancreas is an important organ which produces various types of hormones and enzymes, and one of it is insulin. Insulin is a type of hormone produced by the pancreas, and it helps to regulate sugar level in our body. After taking a meal, pancreas will be stimulated to release insulin and then function to bring down blood sugar after a meal. Insulin functions by asking your body cells to use up and to metabolize the sugar and to convert excessive sugar into glycogen to be stored in your body. So there are two main reasons why diabetes can happen. Number one, when your pancreas is unable to produce sufficient amount of insulin. Number two, when there is insulin resistance. In simple words, the insulin is there, but then the cells which are supposed to react to insulin, they fail to respond appropriately to insulin. So there are type 1 diabetes, type 2 diabetes, and gestational diabetes, which is diabetes in pregnancy. The common diabetes which we always encounter are mainly type 2 diabetes. So how common is diabetes? Based on National Health and Morbidity Survey, which was done in Malaysia in the year 2011, it found out that every 1 in 5 Malaysians aged 30 and above has diabetes. And this is a very serious and high figure. And the number is, I think, a lot higher than the current pandemic COVID-19 patients. So what are the symptoms of diabetes? You may not experience any symptoms at all, or you may experience unexplained weight loss, increase in appetite, increase in thirst, need to pass urine frequently at night, and you may feel easily tired, or you may get frequent infections. So who are the group of people at risk? Common risk factors include obesity, high blood pressure, high cholesterol, heart disease, physical inactivity, or if you have a first-degree family members having diabetes, or if you have history of diabetes while you are pregnant, then you are at a higher risk of getting diabetes. So who and when to screen? I would suggest that any adult aged 30 years old and above, with or without risk factors, to screen for diabetes. If the tests show that you are healthy without diabetes, then you should get yourself tested on a yearly basis. This is because that even if you do not have diabetes today, this doesn't guarantee you that in future you won't get diabetes. The test is easy to do and widely available. A normal fasting blood sugar is less than 6. Any level above 7 is diabetic range. Level between 6 and 7, we call it as impaired fasting sugar. There is another test which we call HbA1c. It gives us a better picture of the sugar level over the past 3 months, and a level above 6.3% is considered diabetic range. So as a physician, sometimes I feel that I'm the one who is more worried than my patients when I found out that their sugar level is very high. Oh, my sugar level very high. I just taken durian ma, it's okay, tinggi a bit, never mind one. Oh, sekarang bulan raya, makanan banyak sedap. Lepas raya ni nanti I exercise, I jaga badan sikit, I exercise, I jaga makan. So these are the common responses doctors will get from patients. Well, why are the doctors always so concerned about blood sugar level? The reason is because poorly controlled diabetes can produce complications which can potentially cause harm to our patients, be it short-term complications or long-term complications. Short-term wise, if the sugar level suddenly shoots up too high, it may cause a condition called diabetic ketoacidosis, in short DKA, or hyperglycemic hyperosmolar state, HSS. These are life-threatening medical emergencies where the patients will need to be managed in ICU care settings. However, if the sugar goes too low, the patient will experience hypoglycemia. Long-term wise, persistently deranged blood sugar can damage our various organs from the head to the toe. And if the damage has already been done, most of the time the damage is irreversible, which means it is not salvageable anymore. Diabetes has been found to increase the risk of stroke, and stroke is a serious and debilitating condition. Minor stroke may leave you with slurring of speech, mild weakness over one side of your body. However, if a major stroke, it may leave you bedbounded for the rest of your life, and it may also take your life away. Diabetes will also progressively damage the small blood vessels in your eyes, whereby causing progressive blurring of vision, and eventually you may get blind. Laser therapy may help to slow down the progress, but if blindness is already happened, it cannot be reversed. Diabetes also poses as a risk for a patient to acquire coronary artery disease, whereby there is narrowing and occlusion of the blood vessels supplying the heart. This leads to increased risk of heart attack, which is currently one of the leading causes of sudden death for Malaysians. Diabetes is also a leading cause of end-stage kidney disease in Malaysian population. End-stage kidney failure patients will need to undergo regular hemodialysis or peritoneal dialysis or a kidney transplant for them to continue surviving. Diabetes can also damage the nerves, and many of the patients, they experience numbness and tingling sensation over the hands and the feet due to damage to the nerve endings. In severe cases, some patients may experience persistent and continuous pain or burning sensation which is very unbearable. Diabetes also increases the risk of patient getting a diabetic foot ulcer, and diabetic foot ulcer can be very hard to heal, and they may get infected with bacteria. In severe cases, doctor may need to amputate your limb to save your life. So please imagine that what will happen to a person if any of these severe complications were to happen to him or to her. If any of these happened to me myself, I can't imagine that my life would totally be turned upside down. I might not be able to continue my work and to continue to take care of my family, and I may be dependent for the rest of my life to my other family members to take care of me. Does this sound like a big deal? Yes, this would definitely sound like a very big deal to me myself. However, please keep in mind that not all diabetic patients will develop complications. The key here is early diagnosis, early treatment, and good compliance to treatment. With early treatment, we might be able to avoid complications mentioned before this. I've seen patients who are diabetic for 30 years or so and living a good happy life like any other people without any complications. Unfortunately, if by the time of diagnosis the complications are already there or already has happened, with proper treatment we may be able to slow down or to stop the progress of the complication. With proper treatment, we aim to improve quality of life. We aim to reduce or to avoid complications, and we aim to prevent premature death in our patients. However, diabetic treatment is not a one-man show. We need a good doctor-patient relationship, supportive family members, a teamwork from other healthcare providers such as a dietitian, pharmacist, diabetic nurse or diabetic educator. They all play a very important role for a patient to achieve successful treatment. And again, I think many of us get bored listening to this, like a parent nagging to a child, healthy lifestyle, and healthy lifestyle. Practicing healthy diet, regular exercise, and maintaining proper body weight is very important, no matter you are diabetic or not. But as a human being, we should practice healthy lifestyle. I know it's easier said than done, but with healthy lifestyle, we can prevent or avoid a lot of diseases. So what are the treatment options available? There are pills, which are taken through our mouth, injectables such as insulin, and there are many types of pills which work through different pathways and different types of insulin. Every patient is different, and there is not a single standard treatment plan which fit all diabetic patients. If let's say you are a diabetic patient who is currently taking 2 tablets of metformin twice a day, and you found that, and your partner found that he or she is newly diagnosed to have diabetes, please don't initiate your same treatment to your partner, because this is a very dangerous practice. Each patient needs to be properly evaluated, need to be properly assessed by a trained doctor before initiating any treatment or medications. Doctors will take into consideration various factors before we start on any treatment or any medication to each particular patient. If you cannot remember anything I say about my talk today, please remember just one thing. Diabetes is, yes, it's hell of a big deal, and please do not take it lightly. If you have any problems or questions, we are always here to help. And thank you for listening. And now we open for questions and answer. Right. Thanks for the comments. There is a question. Is it okay to substitute sugar with stevia? Yeah, stevia is a sweetener which is approved by the FDA in the US to be used as a substitute for sugar. So yes, the answer is yes. Hello, Dr. Prem. Hello, Joyce. Good afternoon. So while waiting for questions, I think many people will be wondering, does medications to treat diabetes harm my kidneys? Right? I think this is quite a common question among my patients. So like what I always tell my patients, as a doctor, we are taught to first do no harm to our patients. So we will not give any treatment which we think will potentially cause harm to our patients. So diabetic medications are actually quite safe to be consumed if your kidney function is normal to begin with. However, if your diabetes has been there for so long, the diabetes itself may cause impairment to your kidneys. So when kidney impairment has already happened, there are certain medications which will not be suitable to be used anymore. Okay, so in that condition, we may need to adjust the dose of the medication, or we may need to substitute with insulin therapy. So in short, diabetic medication are actually safe for our kidneys, but if you have kidney problems, then we will need to review back the medications and to adjust, and you may need insulin therapy. Okay, so Janice here asks, okay, what are the warning signs or symptoms that my blood sugars are too high? All right, some patients, they may feel unwell, they feel not as their own self. Okay, in very severe conditions, like what I mentioned, like diabetic ketoacidosis or HSS, patients will be ill. Okay, they may be feeling tired. You may feel tired. You may have a high fever. You may feel unwell, tired. You may have vomiting, and in very severe cases, you may go into coma. All right. So those are some of the symptoms which may indicate you have very high sugar. So Noramin here asks, orang kurus boleh kena diabetes? Yes, the answer is yes. Yeah, orang kurus boleh kena diabetes juga. Oh, so jangan ingat badan saya kurus, saya tak akan kena diabetes. That is a wrong concept. Oh, any one of us, even with or without risk factor, ada faktor risiko atau tak ada faktor risiko, boleh kena diabetes juga. Okay, Joyce Cole here asks, what is the diet for diabetic patient? So, generally speaking, for diabetic patient, we try to advise the patient to cut down the overall calorie intake. All right. So, if you want to know a very comprehensive diet plan, here I will usually advise the patient to see a dietitian Okay, but generally speaking, low calorie diet and try to cut down carbohydrate intake, because carbohydrates will be digested and be converted to sugar, which will worsen your diabetes control. So Stanley here asks, diabetes patient got to take medicine lifelong? The answer will be yes and no. So diabetes is a lifelong, is a chronic disease which will follow you till the end of your life, and at the current moment there is no treatment which will reverse the condition. But however, in certain patients which I manage, for example, if the patient has worsening kidney function and end up having end-stage kidney failure, some of them end up not requiring any medications or insulin. When certain patients they have this condition called end-stage kidney disease, and then at the time, then the patient will end up no need to continue any more tablets or insulin. So how safe is it to use stevia? Like what I mentioned, stevia has been approved by the USA FDA, Food Drug Association, to be used. So I would say that it is safe, but then I wouldn't regularly suggest my patients to take a lot of stevia. So you can have it as needed, and I don't think there is a harm of using it. Okay, Noramin tanya, kenapa orang mengandung senang kena diabetes? Okay, orang yang mengandung, wanita yang mengandung, dia ada perubahan hormon dalam badan, iaitu dia punya estrogen dengan progesteron dalam badan akan bertambah banyak dalam sistem. So perubahan hormon itu akan menyebabkan seseorang wanita untuk dapat risiko yang tinggi untuk mendapat diabetes semasa mengandung. Tapi diabetes semasa mengandung ini lepas bersalin dia boleh jadi baik, okey. Tapi ada dalam sesetengah pesakit, walaupun lepas dia bersalin, diabetes tu dia berterusan, okey. So that's why lepas bersalin, kalau seseorang pesakit masa mengandung ada diabetes, lepas 6 minggu bersalin, doktor akan minta pesakit untuk buat ujian sekali lagi untuk review balik sama ada diabetes itu sudah baik ke atau masih berterusan. Okay, what are the signs and symptoms of hypoglycemia? So hypoglycemia means blood sugar level drop too low. Okay, blood sugar in our body, it acts as a energy source for us to talk, to think, and to work. So when the blood sugar is too low, we will feel weak. Some patients may feel trembling, sweating, they feel giddy, and in severe cases, you may lose your consciousness or may even go into coma. So if let's say any of these symptoms happen, especially in diabetic patient, quickly, if the patient is still conscious, quickly give some sweet drinks or sweets for the patient to consume, which can bring up the sugar in a short time. However, if the patient has been unconscious, quickly call an ambulance or send the patient to the hospital immediately. Joyce asks, do I have higher risk of diabetes if I have family history? Okay, you will have a higher risk, especially if your first degree family members have diabetes. For example, your parents, your siblings, okay, so they are considered as a first degree relative. So yes, the answer is yes. So Norasha asks, does a child have tendency to get diabetes if the mother has it during pregnancy? The answer will be no. If a mother has diabetes during pregnancy, it does not affect the child to get diabetes, right? Stephen T here asks, what is your comment on eating durian plus beer, a lot of it? My comment is that it's not a good idea. A lot of beer and a lot of durian, that's a big no-no. But like what we always advise our patient, we have to do everything in moderation. Alright. I know it's hard. I mean, it's hard to ask a patient not to eat durian. It is too tasty. So we always advise you take in moderation. Alright. Yeah. Thanks. Hazira here asks, for newly diagnosed diabetes, how frequent of self-monitoring blood glucose do you recommend? Okay, that would depend. That would depend on how bad is the initial blood sugar. All right. If let's say the patient come to me with a sugar of 20 at the first place, so after I initiate a treatment, if the patient can afford or is able to do a home sugar monitoring, then I would suggest the patient to do it daily until the sugar is stable. But however, if the blood sugar level is not too bad in the beginning of diagnosis, I may ask the patient to monitor the blood sugar maybe alternate days. Okay. But if let's say the sugar control has been very stable all the while, then we can reduce the frequency of the blood sugar monitoring. Siti, kalau parent ada diabetes, anak pun ada risiko. Yes, kalau ibu bapa ada diabetes, anak ada risiko yang lebih tinggi dari orang biasa untuk dapat kencing manis. Okay, I think that if there is no more questions, I think our Facebook live session will end today, and I hope everyone continue to stay safe and see you soon. Yes, thank you.